happens when you get the wind knocked out of you? And why is it that you can't breathe again for a while? This phenomenon is a temporary, acute dysfunction of the respiratory system, specifically involving the diaphragm. Our diaphragm is innervated by the phrenic nerves, enabling its contraction for inspiration and relaxation for expiration. The key to this particular sensation, however, lies in its close proximity to the solar plexus, anatomically known as the celiac plexus. This is a dense network of autonomic nerves located in the abdomen, just anterior to the aorta and posterior to the stomach. When a sudden, blunt force impacts the upper abdomen, directly over the epigastric region, it delivers a shock to this sensitive celiac plexus. This impact isn't just superficial. It transmits significant mechanical energy to these autonomic ganglia. The immediate consequence is a sudden, uncoordinated, and often painful spasm of the diaphragm. The normal rhythmic neural impulses that coordinate diaphragmatic movement are momentarily overridden or disrupted. In this spasmodic state, the diaphragm often freezes in a partially or fully contracted position. This inhibits its normal excursion, preventing a full relaxation for complete exhalation, and critically blocking the ability to achieve a sufficient contraction for a forceful inhalation. The individual feels an intense sense of breathlessness, a crushing inability to draw air in or push it out, even though the lungs themselves are undamaged. It's a disconnect between the respiratory control center and the primary muscle of respiration. Fortunately, this diaphragmatic stunning is temporary. The autonomic nervous system gradually recovers, and the celiac plexus ceases its overstimulation. The diaphragm relaxes from its spasm, and the phrenic nerves regain their normal control, allowing rhythmic breathing to resume. This recovery typically occurs within seconds to a minute. So, getting the wind knocked out of you is not about damage to the lungs, but a transient neural disruption leading to a diaphragmatic spasm. A striking example of how closely our neural and muscular systems are linked in essential physiological processes.